Welcome to the DeCesaris Cancer Institute. You're watching this video because your healthcare providers believe genetic counseling may help us better understand your personal or family history of cancer. This may provide key information for you and your family's future care. Also, genetic testing may help us tailor your treatment plan or screening for certain cancers. Your genetic counseling session takes about an hour. Remember, it's a conversation, not a physical exam, where your genetic counselor takes your personal and family health history to determine if you're a good candidate for genetic testing. You also discuss how genetic testing may be beneficial for you and your treatment. If you move forward with the testing, one tube of blood will be drawn and sent to the testing lab. There, the lab checks your insurance benefits. If your insurance doesn't cover the cost of the testing, or if you want to pay out of pocket for testing, there's a reduced out-of-pocket cost. Following testing, your genetic counselor calls with your results and helps you understand their meaning. Most results come back in 2 to 3 weeks, but urgent testing is done in 5 to 12 days if you have an upcoming surgery. It's important to know that, unfortunately, cancer is a common disease. This means everyone has a risk to develop cancer. Some cancers are more common than others. For example, 1 in 8 women are diagnosed with breast cancer, while 1 in 20 people are diagnosed with colorectal cancer, and 1 in 75 people are diagnosed with pancreatic cancer. When it comes to genetics, there are 3 kinds of cancer: sporadic, familial, and hereditary. Most cancers are sporadic, or random cancer, which means there's no family history of cancer. Sporadic cancer is usually diagnosed over the age of 50. Another type of cancer, familial clustering, happens when your family has multiple people with the same type of cancer. The fact that more than one person in the family has cancer is often due to a combination of factors, including shared environment, lifestyle, or genetic factors that we don't fully understand. This type of cancer is also typically diagnosed after the age of 50. Finally, the least common cause of cancer happens when you have a genetic or hereditary predisposition for cancer. This only happens in 5 to 10% of individuals with cancer. When we say hereditary cancer, we're referring to your genes. Genes are the instructions that tell your body how to grow and develop. We have about 25,000 genes, but right now, we only know what about half of them do. We have 2 copies of every gene, one from mom and one from dad. Each gene has its own job. Some genes are responsible for hair and eye color, and others are responsible for protecting the body against developing cancer. Everyone has these cancer protection genes, and we want them to work correctly. These genes are like police officers in your body, making sure criminal tumor cells don't grow out of control and develop into cancer. Remember we said you have 2 copies of every gene? If someone has a genetic predisposition, it means that one of the 2 copies of the gene, either the gene you inherited from your mother or from your father, isn't working properly. This means you have less protection against cancer compared to people with 2 working copies of their genes. In other words, you have fewer police officers in your body to protect you against the same number of criminal cancer cells. Genetic testing helps us determine if your personal or family history of cancer falls into the 5 to 10% piece of the pie, and if you were born with an inherited genetic mutation associated with an increased risk for cancer. Knowing this information may help us understand your risk for developing another cancer in the future, which may play a role in your screening for future cancers or management of your current cancer. There are several characteristics of your personal or family history that can increase your likelihood for a hereditary predisposition to cancer, such as an early age of diagnosis or certain patterns of cancers in the family. At your visit, your genetic counselor assesses your personal and family history to determine how likely it is that you have a genetic mutation that may have contributed to you or your family member's diagnosis and explores with you how this information may affect both you and your family. We look forward to seeing you soon. If you haven't already done so, please call us at 443-481-5081 to schedule your appointment and complete your pre-visit questionnaire.